Now we start scanning. Here we see a urinary bladder. Here you see an echogenic mass in the posterior wall of the bladder. Here is also an echogenic area posterior to the mass, which is a stone. Here we also see a shadow of this stone. Now we start measuring this stone. The size of stone is 2.9 centimeter or 29 millimeter. Here we also see a echogenic debris in the bladder, which is basically a blood contents. Now we measuring the mass. Anterior-posterior size of mass is 9.9 millimeter and longitudinal size of mass is 24 millimeter. Now we also measuring the size of wall, which is 7.1 millimeter. Now on color Doppler, there is no flow in the mass, but we see the flow on the stone, which is called twinkling sign. Here we see a well-defined, approximately oval-shaped prostate. On color Doppler, we see minimal flow. No mass lesion seen in the prostate. Now we will measure the volume of prostate. For that we need a transverse view and an oblique view. Now we start measuring the volume. For that we need 3 measurements. The volume of the prostate is 58 ml, which is enlarged. The normal volume is 30 ml. Now how we will write report. Urinary bladder contain an oval-shaped calculus size 29 millimeter. An echogenic irregular wall mass also present in the posterior wall of the bladder. On color Doppler, no flow is present. The walls of urinary bladders are also thickened, measuring 7 millimeter. The urine in the bladder also contain an echogenic debris, which may be a blood contents, as patient is complaining of hematuria. Prostate is also enlarged and no mass seen in the prostate. The ultrasound diagnosis is urolithiasis with fibrin clot, cystitis and benign prostatic hypertrophy.